this is Nigel Kennedy from the Village Dental Centre in Brighton, the home of pain-free dentistry. We're going to speak today about dental implants, what they are, when we use them and what's involved, and how they may help you, patient or the viewer of this video. A dental implant is basically this little device that we have here in front of us. It looks a little bit like a conventional screw that you would put into a wall or in to hold a shelf up. It's almost like that, but it's made of titanium and it's got very sharp cutting edges, and that's basically what helps it to grip the bone in order to stay in place. What a dental implant allows you to do is to replace teeth that are missing. So if you've got a gap anywhere, or if you've got a denture that doesn't fit very well and it's getting loose and it's embarrassing you and you're finding you can't go out for a meal anymore, a dental implant can help to secure that denture. If you've got a gap somewhere, missing teeth, it doesn't look very nice, and rather than having a bridge, which involves doing treatment to the teeth on either side of the gap, we can put in one of these little things, and that involves no dentistry in the teeth on either side, so there's no future dentistry either. It just replaces what's missing. So we put the little implant bit in itself, which is the little screw there, and on top of the little screw, you may or may not be able to see that as another little metal piece, which we call it the abutment, but it's the bit that sticks up in the mouth that we then eventually put a cap on or a crown. So as I said, it can be used in situations where you've got missing teeth, loose denture, or you just want to fill in some spaces that have been sitting there for years with nothing going on, no teeth to bite on. And of course, if you're using just your front teeth to chew on, they're going to wear down quickly. Not only that, but they're not designed for chewing with, so they won't last you. So you really need to do something about missing back teeth as well. So what does it involve? The nice thing about the technique that I've learned recently in the States is that it's so much more user-friendly from the dentist and the patient's point of view. Conventionally, what dentists had to do was to involve themselves in two levels of surgery for the patient. The first level is to place the implant, making a cut in the gum to put the implant in, and then the implant would be buried below the gum, stitches would be put over the top, and then the dentist would have to go back and find that implant in 3 months once it had integrated or healed with the bone around it. The trouble was you'd then need to go back and find the implant, which meant having surgery again and stitches and everything. So what I found out in the States is that it's become much more user-friendly, a lot simpler and less invasive from the patient's point of view, which is great. Now all we need to do is make a tiny little puncture hole in the gum about the size of a matchstick head, make a drill hole through that, thread the implant in on day one, tighten it up a bit, and then we can shape that little piece that projects onto the mouth, the little metal bit I was talking about before, and then 8 to 10 weeks later we can just fit a crown. So there's only 2 visits. The first visit to place the implant, the second visit just to fit the little cap on top of it. So what are the advantages to you, the patient? One is it's a lot better from the point of view of healing. You're not having the surgery that causes all the discomfort afterwards. You're not having the gum cut, which is what delays healing, causes post-operative pain. Not with that, you're not having it twice that it's needed done conventionally. You're having one visit, tiny little puncture hole, next to no problem afterwards, so your healing will be a lot quicker. Your visit to us will be a lot shorter. You can have the crown fitted much quicker rather than waiting 3, 4, 5 months, sometimes even 6 months. You can have it fitted 8 to 10 weeks later. Again, from your point of view, it's affordable as well. It's cheaper than a conventional implant, from £1,900, which is basically the implant, the abutment, the cap or crown on top, all included. And that can be from what, £50 per month to pay something like that over a period of time. So if this is something that interests you, you feel you benefit from this treatment, why not ring us on the Village Dental Centre, 88 55 22. And this all comes with our home of pain-free dentistry guarantee of we'll do the gentlest dentistry or your money back. Thank you for watching.